Hello everyone, welcome to Fellow Agro. My name is Felix Martin. I'm a doctor of veterinary medicine, and today we are going to discuss poultry diseases. For today, we'll discuss avian aspergillosis. Let us go to see the common names of the disease, the clinical signs and lesion, the differential diagnosis, causes, transmission, and epidemiology. Also diagnosis, prevention, treatment, and recovery. We can start with the common names of the disease. Aspergillosis is called by many names. People used to call it brood pneumonia, mycotic pneumonia, fungal pneumonia, Aspergillus, pneumomycosis, colloquialism. In fact, if this disease occur in hatchery, we call it brood pneumonia. But if it occur in mature beds, we call it aspergillosis. Now let us go to clinical signs of disease. Aspergillosis occurs as an acute disease for young birds, but in mature birds, it's very chronic disease. Young birds have trouble breathing and gasp for air. Characteristically, there is no respiratory sound associated with this disease. Feed consumption decreases. Occasionally, there is paralysis or convulsion caused by fungal toxin. You know this disease is caused by fungus, so there is fungal toxin which causes paralysis to these birds. Mortality in young birds ranges from 5 to 20, but in mature birds the mortality is below 5%. Let us go to lesions. Typically there is yellow greenish nodules and the fibrin deposition in the air sac, lungs, and the liver. It can also occur in other sites like the peritoneal cavity and the heart. Also there is bone, there is solitary abscesses in brain. If you open the brain, you can find separated a bunch of abscess which is covered by thin layer, so we call it solitary abscesses. Now, how can you differentiate the disease from the other diseases? This led us to differential diagnosis. Aspergillosis has no specific signs. You cannot say this is aspergillosis by looking at only sign, specific sign. There is no sign. So it depends on the system also involved. And the disease may produce similar signs to dactylorhizosis. Pulmonary aspergillosis is usually differentiated from other respiratory diseases by granulomatous lesion at necros. But need to differentiate the disease from other mycosis and mycobacteriosis. However, exudative fibrinous and pleural air circulatitis and pneumonia need to be differentiated from mycoplasmosis, colbacillosis, and fall cholera. Now, what are the causes of the disease? Transmission and epidemiology. This disease, as I have said, it is caused by fungus. The main species which affect or cause this disease is Aspergillus fumigatus. Another species which can cause disease is Aspergillus flavus and Aspergillus niger, but the main or common cause is Aspergillus fumigatus. Now let us go to transmission. Before talking transmission, let us know the source of the disease. You can find this disease causing agent in food, litter material, water, and the dusty particles which are attached on the wall of the pot house. So the disease is transmitted by air drops. Drops from the respiratory system. When these birds get contact or inhale these uh, air drops or exhale respiratory drops, get the disease. So the main cause of the disease, the main ways of transmission is inhalation, but also ingestion some point when the feed is contaminated with this fungus. What is the diagnosis? How can you diagnose this disease? Clinical signs and lesion are important in diagnosing the disease. But if you want to confirm the disease, you need to go to the lab and make a microscopic examination to identify which is the main cause. By going to the lab, you will see this fungal growths of hyphae.